Hello, my name is Roxana Moran from Mount Sinai Hospital in New York, and welcome to EuroPCR TV. We're here at EuroPCR 2015 in Paris, and we've had a fantastic meeting, but I'm here and joined by my colleagues, Dr. Antonio Colombo from Milano, and Dr. Rafael Romaguera from Barcelona, Spain. Welcome. We're here in a really nice conversation on the session of Cre8 polymer-free DES in diabetic patients. Dr. Colombo, what are your current challenges that you're facing in your daily practice? What groups of patients, especially the diabetics, what are those challenges?
You know, the problem with diabetics is thrombosis, is restenosis, and new lesions. We can deal maybe with new lesion with better prevention, better control hemoglobin C, HDL, but instant restenosis is a problem. And we have been striving for so many years to find the ideal stent or the best stent for diabetics, and unfortunately failures has been the result.
Even with these next generation DES?
Even with next generation DES, I think when you look at the 1 year follow-up and you do angiographic follow-up, the restenosis is double digit and the TLR sometimes reaches 10%.
Wow. Dr. Romaguera, I know that you just presented beautifully. Congratulations on the results of the reservoir study. Can you just tell us a little bit about the Cre8 stent, as well as what brought you to design this particular study, the reservoir study that you just presented here?
Thank you, Roxana. I do believe that the diabetic patients need a drug-eluting stent with very specific characteristics. And the Cre8 stent is a polymer-free drug-eluting stent that releases sirolimus from laser duct wells. And the sirolimus is formulated with long-chain fatty acids. These characteristics might increase its efficacy because the diffusion of the drug to the vessel wall is very increased. For this reason, we designed the reservoir trial, which is a randomized trial that compares the Cre8 stent with the stent that we thought that has the most robust evidence on safety and efficacy, which is the Science stent. And we randomized at 4 centers in Spain, 112 patients with diabetes treated with oral drugs or insulin to Cre8 or Science. And the patients underwent invasive follow-up at 9 months with OCT. The primary endpoint was the neointimal volume obstruction by OCT, and the results shown that the primary endpoint was met, showing the non-inferiority of the stent, and other secondary endpoints were amazing because the late loss of the Cre8 stent was very low, was 0.14 as compared to the Science stent that was 0.24. And the most important is that the Cre8 stents show a very low rate of dispersion of the data. So most of the results were very close to zero, but positive, as compared to the Science that has some negative remodeling, some positive remodeling, and some cases of restenosis.
So very interesting data, interesting stent with the polymer-free technology, reservoir. So the drug is eluted. What did you make of these data? Were you impressed, Dr. Colombo?
I was impressed, but not surprised, because I expected this data. Because our experience with Cre8 dates back to 3 or 4 years, and we have been using this stent in diabetics, and we have been pleased with positive results. Unfortunately, we do not have a formal large-scale randomized study to back up in a more scientific fashion. This study will be done.
So that's the future plan?
Will be done, no question, because we need to convince the scientific and the clinical community that our observations are replicated with a designated and prospectively conducted trials.
So in your own clinical experience, you've had great results, but you want to show that to the world by really having a prospective randomized studies at multi-center.
Absolutely. As always, observations need to be confirmed with a properly designed study. We have been burned so many times by smart observations that rest just in the past history.
Well, this is fantastic, and I think it's an optimistic view for these diabetic patients who otherwise have very little reserve and very little options. So I think that this particular stent does show a promise, and I'm looking forward to your large-scale clinical study, Dr. Colombo.
And maybe we can go back to Mount Sinai and propose the Freedom 2.
Yeah, wouldn't that be great? Wouldn't that be great?
Freedom 2 with Cre8.
Well, with that, I think this is fantastic. Thank you so much for joining us. This has been a great interview and wonderful to have you both, but a real great wrap-up here at EuroPCR on the Cre8 stent in the diabetic patients, its utility, the future plans. Thank you very much for joining in and for listening.